name is Filimone Tarai. I'm originally from Telebo, based here in Nandi, Fiji Islands, and I work for Fiji Airways. Currently, I'm at the PSH Hospital, being treated for bypass. I just underwent surgery. My situation started off as anything normal. I'm just normally traveling day in, day out to work and back, going past this building that's here close to the Nandi airport. I never thought in a million years that I'd be sitting in one of these rooms talking to all of you. But I'd like to just share my experience very quickly. I wasn't feeling any pain or anything. There was no condition, what they talk about when you have a heart attack or anything like that, nothing like that. I just felt fatigue, decided to go to the doctors to go and get checked. It went on from a check, just a simple check, to then a more advanced check where I went through angiogram here at PSH, and then they identified that I had 4 blockages. In the 4 blockages, there were situations where they've just said, you're lucky to still be alive. A lot of things were running through my mind. They took my wife over into a room, the doctor, and spoke to her and showed her all the angiogram results, and then explained to her that I was hanging by a thread. For me, just looking at my wife's face, I could tell that there was something really wrong. The worries that came into my head was the thought of, okay, how am I going to do this? Treatment overseas, and all of these things started coming to mind. The surgery was amazing, but the services that were provided, this is the part that I really enjoyed. The before, the during, and the after. The before, situations that you go through like this, it's not an easy thing when somebody tells you have to cut open your chest to pull out your heart, to try and do some things with it so that you can live a few more years. It's not an easy thing to take in. Just the thought of it alone can kill you. But I was so thankful that the team came over, they'd come and they'd encourage us and say, oh, this is a normal thing. It's a procedure that's normally done. So that was encouraging. And then come the services of the surgery itself, going into the OR. Not an easy thing to see. But I was so thankful to God that He was with me all the way, touching the hands of the surgeon, Dr. Sanjeev and his team. Dr. Veroniki was there, Dr. Matai, Simiti, and the nurses. And also, straight after that then comes the third part, the taking care of the person until they're fit enough to come into one of these wards that I'm sitting in now. That was another situation. I stayed in ICU for about 3 days. And in the 3 days, there were so many things going through my mind. It was whether I was going to make it or not going to make it. But I was so thankful to the